Welcome to Cure America. I am Donald Easton, the new president of Cure, and I have the privilege to sit down here with Dr. Simone Gold. Let me tell you, I mean, getting ready to just fawn over her for a second. She saved my life during COVID. We caught COVID. I was in such bad shape. My wife actually got in the car and drove 5 miles to get me some, not 5 miles, about 50 minutes to get me medicine that the American frontline doctors had prescribed to me. And they told me if I took this medicine, I will be better in 48 hours. And I was in such bad shape that I was not even sweating. My fever was so high. And I knew my fever had broken when I started sweating again. And so it's the American frontline doctors and what you presented to us. I can remember you on the steps in Washington, D.C. And so I just want to ask you a question. Absolutely, absolutely. And so as you look at healthcare as it progresses right now, what made you start American Frontline Doctors, and how did you come up with that idea of just having that interview? And I know you wanted to come up with the solution. And could you just tell me a little about your story about how we got here?
Thank you, and thank you so much for inviting me. And it is always wonderful to hear those stories, because at the end of the day, it's about the individual. It's about the human being. Everyone is a mother, father, sister, brother, and we cannot forget that the individual is important to us. In 2020, I was working as an emergency physician. I was board certified emergency physician, very experienced, never had a crossword said about me or really to me, good reputation, all that. But I was noticing there was a lot of lies, a lot of disinformation, a lot of propaganda. I knew that based upon my education, but also just upon my direct observation in the ER. I was working in the ER, and what people were saying at the coronavirus task force meetings and all over CNN and even Fox News, it was inaccurate. It did not reflect the reality on the ground. So I was reading all of the research, and I knew that people didn't have to be as afraid as we were teaching them to be. We were teaching people to live in terrible fear. We were teaching them, stand apart from each other, close the schools, cover your face. It made no sense. If you went to any public health textbook, it violated everything that Public Health 101 was. So it took me a couple of months to really kind of ramp up, but I was very certain that the government and the media was lying to people. I just had to then get the word out. And I thought about how to do that. So we organized a lot of doctors online, and we decided to speak directly to the American people. We called ourselves America's Frontline Doctors, and we stood on the steps of the Supreme Court on July 27, 2020, and we told everybody, don't be afraid. That was really our first, most important message. Don't be afraid. Two, masks really don't, not really, I'll eliminate the word really. Masks do not work to stop inspiratory or respiratory viruses. The pore size in the mask is much bigger than the micron size of the virus. And number three, there's early treatment available should you want it. And I stood there with what I called YouTube influencers, and we just broadcast this to the world. And much to my shock, it just became a huge viral sensation. We had 20 million views in 8 hours. That's an extraordinary number. And then Mark Zuckerberg, Facebook, Instagram, Twitter, everybody deplatformed us simultaneously, which was highly alarming. Why were they so threatened by doctors saying this? And so sometimes people say to me, did I plan this? I said, you can't plan this. And it's not me. It's that I was speaking truth, and truth has a way of getting out. And from that moment on, I went from being this highly respected, highly regarded, board-certified, experienced emergency physician with a stellar reputation to being very mocked by half the nation and highly regarded by the other half. But that half that listened to us when they came down with COVID came to our website, and they found answers as opposed to lies. And I'm so proud that we think we've helped about 1 million Americans access early treatment medicines.
And you also have helped repair the relationship between patient and doctor.
Yeah.
Because that was interfered with during COVID.
So I'm a daughter of a doctor, and so I was involved in medicine. I like to just say really from before birth onward, but my whole life was involved in medicine. I would go with my father to the hospital and the nursing homes as he did rounds. We had an office in our home. So I am kind of this interesting age where I really do know how good it can be to be a doctor, how wonderful and special the doctor-patient relationship is. And if a patient has a good, worthy doctor, how important that person is to each person. So I know the good that medicine can be, but I was trained, and I'm watching it over the last several decades as a professional, as a doctor, not be that. We have become instruments of the government or the insurance company. So for example, in my father's day, 85% of physicians were self-employed. So they worked for the patient. Nowadays, the numbers switched. About 15% of doctors are self-employed. The other 85% are answering to a corporate employer, whether that's a large hospital chain or whether that's a large insurance bureaucracy. So they became very easy to manipulate. So the doctors overwhelmingly, I'm sorry, but you can't trust them knee-jerk. You should use them as a consultant, but then you have to apply your own thinking to it. And often, in fact, you should get 2 or 3 opinions. Patients don't know when doctors are telling the truth and when they're not. And I don't want to say that doctors are necessarily purposefully lying to you, but when I look back on my own career, I definitely said things that I believed were true, but I never personally investigated. For example, I've taken all shots in my life, in my career, plus have my children. I never thought to investigate, were they placebo double-blind studies? I never thought to investigate, were they really necessary? I just didn't. So your doctor can tell you things that may or may not have been investigated by that doctor and may have a financial incentive to tell you a certain thing. So when you looked back in COVID, it turned out there was massive financial incentives to not give you early treatment. Now that sounds crazy. It sounds like, why would anybody be incentivized not to give you kind of a cheap drug? I'll tell you why. If there was any treatment that worked for COVID, then the government by law was not allowed to roll out the shots so rapidly.
They weren't allowed to roll out the vaccine shots, you're saying?
Correct. So when you think about it, have you ever seen a vaccine rolled out in less than a year? It's unheard of. For reference sake, the typical time is really over 10 years. The fastest time that I know of is about 4.5 years. I think that was the mumps vaccine. Typically, it's 10 years. For example, Fauci worked on the AIDS shot for 35 years and never developed one. So it takes years to decades to build a vaccine that's safe and effective. So how do you roll something out so rapidly? There are legal safeguards to prevent that. The underpinning requirement to roll the vaccine out rapidly was an EUA, an emergency use authorization, but you can only have an EUA if there's no other treatment available. This is why our nation besmirched hydroxychloroquine and ivermectin. Other nations didn't do that. If there was ivermectin or hydroxychloroquine that would work for this thing, then there was no legal way to roll out the vaccine so rapidly. That was the financial impetus, and your doctor that you went to see had no idea.
And that was a big part of interference between the doctor-patient relation, because we had never seen a pharmacy not prescribe a drug that.
Oh, that's another one. So the pharmacists are not, this is going to be news for everybody, a pharmacist is not allowed to ask you what your diagnosis is. This may come as a surprise to people because maybe you're not even concerned about the privacy angle and you just think of pharmacy and doctors as, one group. No, by law, a pharmacist is not allowed. There's many privacy reasons. For the first time in my life, you would walk into a chain pharmacy, I don't even want to say their name, and they would ask you your diagnosis. And if you had a hydroxychloroquine or an ivermectin prescription, they'd ask you your diagnosis and they would refuse to fill it. This violated law is already written, and nobody was enforcing the law. So when I look at this terrible situation, I knew that these harms would far outlast COVID, right? We knew COVID was, a self-limited thing. By the way, the numbers and everything about it was worse in America because of our public health policies. But I knew that ultimately patients like yourself, like people in the audience, need a doctor they can trust. And they need a way to be educated on their own and then make their own health decisions. So I've spent the last 3 years building that alternative. It's a medical freedom platform, and it's called Gold Care. I invite you to come join us. It's goldcare.com, and we do it very, very differently. It's actually quite revolutionary. You come and you have to become a member. So it's kind of like joining Amazon. It's not woke, the opposite of woke, But you come and you do an annual membership. It's a very nominal amount. For that nominal amount, you get a massive amount of education. We do medical town halls. I bet if you name any medical subject you're interested in, we've done a town hall on it. Ozempic comes to mind. People are really want to know about Ozempic. People want to know about alternative cancer treatments. They want to know about vaccines. They want to know, what did we do? I'm trying to think what I did. I can't remember what we did last month, but we do tons and tons of these educational seminars, and you get all of that for this nominal fee. Then when if you ever need to make an appointment with a physician, you can just sign up and do that, and the price is very reasonable.
Well, I'm glad you mentioned Gold Care because I actually joined Gold Care, and I had an opportunity to have an examination. Oh,
you did already. I'm so proud of you.
And because it brings back the doctor-patient relationship, and I want you to share with the audience the difference between health care and health insurance, because they're trying to say you need all this health insurance, but what we really need is health care, and there is a difference between the two.
So the hardest thing about what I'm saying is most people have a preconceived idea that they have health care because they have a Blue Cross card in their pocket. That has nothing to do with health care. You have two things that you need. The one thing you need all the time is access to good information so you make good decisions, right? That's how you live your life. If you need to look something up, you look it up, or you find an expert who knows it. That's in accounting or tax or real estate, raising your children, picking a school, where do you want to live? You need access to good information. That is all the time, 24/7. So we do that in spades at Gold Care. Sometimes you need a specialist. You need a physician who puts that doctor-patient relationship first. That's the provider care component. You also need a financial safety net if you live in America. That's what people now have confused with health insurance. They're buying the health insurance because they want to be sure they have a financial safety net should something, usually like an accident or a cancer diagnosis, befall them. They need that financial safety net. We will teach you how to leave the health insurance behind. Now, I'm going to say something shocking that you've never heard me say. Okay? I have not had health insurance for more than 10 years. And you might be like,
people look healthy to me.
Right, I look healthy. It's probably why. No, but it's like a mind-blowing thing to say because people think you can't operate in America without health insurance. It's not true. You need a financial safety net. Gold Care will teach you how to have a financial safety net outside the system. Once you're outside the system, everything is better. It's less expensive. It's more access. It's more freedom. You can see alternative doctors. You can see naturopathic, holistic doctors. You can get second opinions. It's such a better world once you leave the health insurance behind. So what Gold Care does is we provide the education you need, webinars, seminars, emails, information, library. We've got videos. We've got hundreds of hours of videos on all topics you can think of. And we provide the provider care for when you occasionally want to talk to a doctor, and we don't discriminate between doctors. So you might want to see a medical doctor. Maybe you've got high blood pressure or heart disease or cholesterol problems or something like that, or an ulcer disease. Maybe you want to see a medical doctor, but maybe you want to see a naturopathic doctor, right? You wonder women's health, or I'm stressed, or I'm fatigued, or I'm tired, and I really don't want to go the medicinal route. I'd rather see a naturopath doctor. Or maybe you don't know. Maybe you're a menopausal woman and you're like, I don't know if I need meds or if I don't need meds. Let me see a naturopathic doctor and a medical doctor. How cool is that? So we put it all together for you. And this is the best part. As you know, if you've joined, the price is $10 a month just to access us, right? So come join. We welcome you. It's amazing. And, education, provider care, and freedom from insurance if you should want it.
Dr. Gold, thank you so much. Let's give her a hand. Thank you. And again, I'm a big fan. We thank you so much for being with us here at Cure America, and we look forward to spending some more time with you and sharing more information with our audience. Thank you so much.
Thank you so much. God bless.
God bless you.